and go.
So when we are in the situation where the nurse is asking us to assist with a particular patient, it helps to look at the type of patient we have in the room, and 3 different types of patient that are quite common and that might affect the education we provide. Patient number 1, a lot of bariatric patients are shorter, hence the need to show the extra low height, use the right height tool, and that's a specific education you would give for the shorter patient. If the patient is too wide for the bed in its standard setting or too tall for the bed, again we would educate or offer a bolster into the side of the bed or the length of the bed. So again, that's patient specific where it's needed. We also, 3rd type of patient is where we would have one that is what we would call complex patient. So a complex patient is generally one that has got a few other things going on. Maybe they're immobile in ICU, which means they're bedridden, they can't move from out of the bed. And the sort of things we're thinking about there is helping the nurses by offering them a turning mattress to save them doing the turning, even repositioning mattress, and also thinking about that patient starting to mobilise as they recover, the specialist chairs such as the larger Be Cosy chairs, and other specialist or complex equipment. So that's 3 types of patients. One thing to remember is within the mobility of a patient, there's quite a few steps for them. Maybe some patients can only move around in bed, and even if they're bedridden, they may still like things like the bed ladder. And as they progress, they need things to get out of bed, get up and going. So in the ideal world where a patient is getting up and going, they have a walking frame to mobilise, they'll have a shower commode or for toileting and showering, and we call that a hygiene item, and then they would have a chair, like a bedside chair. And again, when we are setting them up with their walking frame and their chair, think about the room, think about where you put the chair sort of beside the bed so they can get across easily, make sure the walking frame's within reach if they're going to self-mobilise. So these are the sort of things you're thinking about specific to a patient.